Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss how sewage waste is predicting monkeypox outbreaks, a new bonus program for New York healthcare workers, and Alaska Health Department director outed for a fabricated resume. Let's wrap things up. This is episode 148 for the week of August 15th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code for this week is Y35.101S, or legal intervention involving unsuspected explosives. Law enforcement official injured, sequela.
What?
This is a very specific code.
Yeah.
Well, I'm glad that I guess ICD, the big takeaway from this is ICD-10 codes appreciate law enforcement.
Right. Also, this diagnosis specifically means that there was legal intervention with an injury. But an explosive injury.
Right.
Where a law enforcement officer was injured.
Yes. The second time around.
Right.
Sequela.
Right.
I wonder, I guess, what is the definition that IC looks at for law enforcement? Is it just police? Are we talking firefighters? Are we talking EMS? Are we talking SWAT? Are we talking?
Judges?
Judges?
What's the law?
Ooh, lawyers?
Right.
They're not officials. But state lawyers would be potentially.
Maybe. Interesting.
Hope this never happens.
Unspecified explosives. Could have been anything.
Could have been one of those little poppers, confetti poppers that people like. Could have been one of those snappers that you throw on the ground. Or it could be something huge like dynamite, which I hope it isn't.
Right. Dynamite would be big.
Dynamite. Speaking of dynamite, first up, we have sewage secret surveillance. This has nothing to do with dynamite. Wastewater sludge was thought to hold promise as an early indicator of community health threats, in part because people can excrete genetic evidence of infectious diseases in their feces, often before they develop symptoms of illness. Sorry for the pause. This is just a ridiculous story. But before COVID, such risk monitoring in the U.S. was limited largely to academic pursuits. The Sewer Coronavirus Alert Network, or SCAN, is now a leader in expanding wastewater monitoring to detect monkeypox that in a matter of months has infected more than 26,000 people globally and more than 7,000 across the United States since expanding its surveillance in mid-June. The SCAN team has detected monkeypox in several Northern California sewer sheds in its monitoring. Funded by grants from the National Science Foundation and the CDC Foundation, SCAN is doing similar monitoring in a total of 8 states and wants to scale up to 300 U.S. sites.
Wow.
That is a crappy job. Oh, man. So it's cool that it's named SCAN, but it should now be called SMAN.
Oh, yeah,
because it's the Sewer Coronavirus Alert Network. But it should be the Sewer Monkeypox Alert Network. But they're not going to change it because SCAN sounds funny.
It does. SCAN is pretty great. They're scanning your poo.
Yeah.
That's really interesting. Like, where do they do it? Does it just go through does it just pass through a monitor? Is somebody there taking samples and running tests? Is it just that's a lot to take in.
Yeah, it's a wild thing, but
crazy that we can do that as a society. Great, what?
Yeah, I don't. It's cool that they do this. It's weird that they do this, but it makes sense.
Yeah.
Hopefully, totally. I definitely don't want anyone fondling my feces for science or otherwise.
All right. Next up, we have investing in healthcare retention. New York is taking healthcare workforce retention into its own hands with a $3,000 payout to certain employees who stay at their post for at least 6 months. The newly launched Healthcare and Mental Hygiene Worker Bonus Program is backed by $1.3 billion from the state's fiscal year 2023 budget. It authorizes the bonuses to workers providing hands-on healthcare services at Medicaid participating provider organizations or certain other licensed entities. The employees must be receiving an annual salary of $125,000 or less to be eligible. Although the payments cap at $3,000 per full-time employee, the state is also offering lower payouts to part-time workers commensurate with the number of hours worked per week. Employers will be responsible for submitting eligible employees for the payments via an online portal. Well, that's pretty cool.
Yeah, it's cool. I think that the reason why it exists is because there's such a shortage in healthcare people because they're all burnt out because of COVID, which is great. But I also think that they can pay healthcare people as much as possible, but the problem is that there's just not enough, right? There's a shortage of healthcare staff. So what's the solution? Well, probably make it a little bit easier to get into medical school, right?
Well, sure.
And I also think
I don't want them just letting anybody in medical school.
No,
I don't want to go to a doctor who just like coasted in because they were like, hey, we just didn't have enough people.
It's like the acceptance rate is like 0.1%. So it's like really low. I don't know the actual statistic, but I do know that it is like ridiculous how low the acceptance rate is. And I also think that maybe there needs to be a restructuring of the education associated with the healthcare landscape. Because I guarantee you there's a lot you need to learn, but I guarantee you there's some stuff in the curriculum that is outdated and doesn't need to be taught anymore.
Sure.
And I don't know how often it gets restructured. I'm just a guy talking, right? So I don't know anything about this, but I'm just saying if there's a shortage in people in the most important, space industry in the world, maybe you need to make it a little bit easier and more enticing for people to join. And maybe this is the enticement, paid more, but retention and joining. It's the two most important aspects. So
for real. Hopefully this helps though. Hopefully it keeps people
it helps.
Yeah.
If you're in healthcare New York, this is good to know.
Yes.
Next up, taking resume exaggerations too far.
Uh-oh.
Anchorage Health Director Joe Gerace resigned Monday, hours after Alaska public media confronted him with evidence that the director had vastly overstated and misrepresented both his educational credentials and military background. An investigation found that Gerace had falsely presented himself as a high-ranking officer in the Alaska National Guard with a pair of master's degrees. These credentials led the mayor to appoint Gerace as director of the city's health department last year. Gerace doesn't have a master's degree, let alone two, records show. And he isn't a member of the National Guard either. His lofty title of lieutenant colonel comes from his position at the Alaska State Defense Force, a group of volunteers that sometimes assist the Guard, but is not part of the U.S. Armed Forces. So he kind of exaggerated it. I mean,
I wouldn't even call it an exaggeration to just lie and say you have two master's degrees when you don't have any.
That part's bad.
That's not an exaggeration. That's just bull.
Yeah, I agree that part is bad. The part with the National Guard, I mean, I don't know. I feel like if they volunteers to sometime assist the Guard, technically he's not in the National Guard, but is there any other volunteer that does? You know what I mean? Like everyone lies on their resume. That's the whole point.
Sure.
Now, lying to the master's degree, again, bad. But saying like, hey, I help the National Guard.
That'd be fine, but he didn't say that.
And then it's up to the recruiter to be like, hey, are you a part of the National Guard? And he's like, well, that's when you kind of say, like, during the interview, like, I work for the Alaska State Defense Force, which volunteers with the Guard. Right. So it's just kind of a compounding issue, but lying about the master's degree is the real big takeaway.
Yeah.
The second part is kind of like media being like, we also lied about this. He probably also lied about how he's a team worker and he works in a high-paced environment, but those aren't as hard-hitting.
Right. He can multitask. He's great at organization. All those things. All the things you say on every resume. All of your strengths. Right. With teamwork, organizational skills, problem solver, critical thinking.
Oh, Microsoft Office.
Oh yeah, the whole suite of Office products. Gosh, so good at those. Anyway,
let's go to our next segment.
Woo-hoo.
BREACH, Breach Patrol. It's a breach. All of the latest cybersecurity breaches.
Welcome to Breach Patrol. Talk about the latest breaches all across the world. First up, we have
2020 California breach settlement. According to a notice on its website, California-based Salinas Valley Memorial Healthcare System SVMHS, first discovered a compromised employee email account on April 30th, 2020. A few months later, the health system determined that a total of 5 email accounts were compromised. In a subsequent lawsuit, the plaintiff alleged negligence and violations of California's Confidentiality of Medical Information Act, CMIA. The lawsuit alleged that the SVMHS failed to adequately safeguard patient information. SVMHS denied the allegations but agreed to settle the suit outside of court. SVMHS agreed to pay up to $340,000 to class members impacted by the data breach. Interesting. Trying to say SVMHS one more time.
More settlements.
Yep. That's what happens.
Lawsuits happen, and they're starting to win $340,000 for a memorial healthcare system is not good. And I mean, this is like, I feel like the last 5 episodes we've had a settlement from a class action lawsuit.
Oh yeah.
Which just says that, like, hey, if you get breached as a healthcare organization at this point and you get a class action lawsuit filed for you, you're not going to win it. I'm sorry. You're not.
Right.
There's just too much evidence against you.
We should call this segment Class Action Patrol, because that's what
Class Action Breach Patrol. Action. Whoa. So yeah, keep it in mind. There are consequences. You can get fined by the government, or you can get slammed with a massive class action fine, which doesn't do anything to the victims, but it makes big headlines and it hurts the organization. So,
right.
But the victims are going to get like $5.
Yep.
Next up, so bad they called the FBI. Indiana-based neurology practice Goodman Campbell Brain and Spine notified over 360,000 individuals of a data breach that occurred this past May. The cybercriminals responsible for the attack posted protected health information, or PHI, on the dark web, where it was available for 10 days. The impacted information potentially included medical record numbers, patient account numbers, treatment information, dates of service, and social security numbers. Goodman Campbell Brain and Spine offered impacted individuals complimentary credit monitoring services. Classic move. Classic. Credit monitoring services.
Hey, and you
it's a good thing to do.
And you get a credit monitoring service. We just
make a lot of jokes about it because it happens so often, but it's a good practice to do because it's about the best you can do for the patients.
Right.
Hopefully they don't get a class action lawsuit.
The best you can do for your patients is to increase your cybersecurity and make sure that you are well trained to prevent breaches from happening in the first place. But the second best thing you can do after you've been breached is give them some complimentary monitoring services.
Give them complimentary monitoring services. Yes. Yeah. We'll see what happens. But it is a good idea to include the FBI.
Sure.
We didn't mention that in the description, but it is in the headline from our producer. So if you get breached and it's really bad, it's okay to bring the FBI in.
Right, because they will investigate. It's what they do.
It's also recommended on their own site.
Right.
Hey, reach out to us. We're here for you. You pay for us in taxes, you might as well do it.
Exactly. And last up, Twitter confirms breach. A Twitter data breach allowed an attacker to get access to the contact details of 5.4 million accounts. Twitter has confirmed the security vulnerability. The data, which ties Twitter handles to phone numbers and email addresses, has been offered for sale on a hacking forum for $30,000. The owner of the hacking forum verified the authenticity of the attack. 2 samples of the database check out. There is as yet no way to check whether your account is included in the Twitter data breach. Okay, $30,000, really? That's it?
It's not very much.
Such a small amount of money.
It's literally what they make in a second, probably.
Like, Twitter could just buy it back. Like, here. It's like nothing to them. Hey. Like, what is that? That's embarrassing.
I don't know, man. It's especially for like tech agencies, it seems a little suspicious.
Very sus. Yeah, it's weird.
Has been offered for sale on a hacking forum for $30,000. It's suspicious. The hacker's like, hey, you know what? I got 5.4 million accounts. You can have it for $30,000. It's at a good deal. It's at a good price.
It's a good price for over 5 million.
It must just be like username and password, email maybe.
I bet it doesn't even have password. I bet it's just like usernames, Oh, it says the data ties Twitter handles to phone numbers and email addresses. So it could involve your phone or your email. Interesting. Well, see if Elon Musk wants to keep buying it now.
Yeah.
Well, I know he wants
Elon,
out of it, so
what are you gonna do,
maybe this
Elon?
will give him an out.
Maybe. It was all just for headlines, and he's like, oh, wait, I don't want to run this business. Whoops.
Whoops.
And that's it for this week's wrap-up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
We'll see you next week.
Bye.
Thank you for listening to the Bandage Podcast produced by eTactics.